It's time for our expert panel, our content experts, people who are out there on in the primarily the DHS arena right now, but we do have a, a SUDS, substance use disorders, a behavioral health uh, organization that's joined us today too, getting those field views from the field. So will our panelists come on down? Can we spotlight them? Brianna. In the
Excellent.
meantime, I'll tell you who they are. And we have Dr. Balani, who is with the Department of Health Services, and you're going to have folks to give a little bit more information about themselves. So I'm just going to say who you are. Dr. Balani is our moderator, and Dr. Manuel Campa is one of our panelists. I didn't see him earlier, but hopefully he's been able to join. And Christopher Abernathy from Social Model Recovery Systems, one of our SAPC contracted agencies here in Los Angeles County, who's had boots on the ground for a long, long time. We had a patient, and I don't know, Serena, if you're here by telephone, will you let us know?
She's here.
Because we don't see you. Okay, wonderful, wonderful. And then we have Rebecca Tafoya, who's a substance use disorders counselor at Department of Mental Health at West Central site. And Dr. Ray is going to join us on this panel as well, as she has been a provider of services through her research. So Dr. Valani, you want to take it away?
Thanks so much, Norma, and thanks to the team here, Dr. Friedman, Dr. Hurley, Brianna, Luz, for having us. Can you hear me okay?
Yes.
Perfect, okay. So I know we're starting a little bit late, so we'll just jump right in. And I thought we could start with introductions, and we're happy to have this panel to discuss from wide perspectives in the field a little bit about challenges and successes in implementation of smoking cessation services, and also our patients' perspectives on that. So I'm Rishikesh Balani. I'm currently the primary care director of the Ambulatory Care Network, which is a part of the Los Angeles County Health Services. I'm also assistant professor of medicine at UCLA. I practice adult primary care at two sites, one in South Los Angeles, Hubert Humphrey Comprehensive Health Center, and also one up in the San Fernando Valley, Olive UCLA Medical Center. And my clinical focus is on medication-assisted therapy for substance use in primary care, and also primary care amongst people living with HIV. Hoping I get everybody's names right, because I know there are maybe some changes. So maybe I'll have our patient introduce themselves. Thanks for joining the panel. Is it Serena?
Yes, it is.
Hi, Serena. Welcome.
Hello, hi. Oh, well, my name is Serena. I'm what do? I tell my age and everything.
No, that's okay. Just we'll get into we'll actually, that's perfect. We'll come back to it some questions. Dr. Campa.
Hi, good afternoon. Thanks for having me, and thanks for this organization for inviting me this week. My name is Manuel Campa. I'm a primary care physician, and I'm the primary care director at LEC USC Medical Center. I'm responsible for the integrated care of over 60,000 patients in the community. My other role is I'm the measure lead for tobacco use screening and cessation interventions for the DHS Quality Incentive Program, which is the value-based care model that we have with the state. So I'm responsible now for monitoring our performance for screening patients for tobacco use disorders, and also how we're linking them to cessation intervention programs within our system.
Thanks, Dr. Campa. Chris or Christopher?
Good afternoon, everybody. My name is Christopher Abernathy. I am the Senior Director of Treatment Services here at Social Model Recovery Systems. We've been providing co-occurring mental health and substance use disorder treatment since 1986, and I've kind of taken on the role of smoking cessation guru over the years here at the agency, so I'm excited to be here. Thank you.
Thank you, welcome. And Rebecca Tafoya?
Yeah, hi, my name is Rebecca Tafoya, and I'm a substance abuse counselor, and I have experience working in different treatment modalities for about 27 years. And I've been with LA County DMH, Department of Mental Health, since 2018, and I'm an addictions counselor at West Central Family Mental Health, and our clinic serves part of South Los Angeles. My role in smoking cessation is engagement, promoting, and providing recovery support, either through individual counseling or in a group setting. So our smoking cessation services are in collaboration with clinicians and psychiatrists, and I co-facilitate smoking cessation groups with Dr. Andrew Kellogg, our clinical pharmacist, and I primarily focus on recovery talking points in the Kick-ASH curriculum. Kick-ASH, ASH.
Awesome, thank you. And then I don't know if Dr. Ray is still on, if she's going to join us as well. Maybe she had to drop off. Okay.
Yes, I think she did. Sorry.
No worries. That's great. We had a great talk from her anyway, so that's great. I think what I wanted to do is really focus on Serena initially and just kind of set the stage about really, the center of our focus is always helping people and patients with their tobacco and tobacco cessation. And so, Serena, I thought we would start by asking you to tell us a little bit about yourself and a little bit about your relationship with smoking and tobacco, and share a little bit about your journey with it.
Yes, I was smoking at least about six cigarettes a day. That would be the maximum. The minimum will be 2 cigarettes, and this would be on a daily basis. I've tried to quit multiple times. Something traumatic had happened, and I had started smoking. Then I tried to reduce it to just evening smoking. That seemed a little bit better, but then sometimes it get to a point where the cravings came, and I could find myself at 2:00 in the morning trying to get a pack of cigarettes when I would try to quit. And I would succeed. I would always succeed. And then I believe it was stress smoking because of my environment, because that was the thing I used to just go to. That was just my go-to thing in order to relieve my stress. I found out later as I was in the group. Being in the group really helped a lot. It really, I still don't smoke today. I don't smoke, and I don't even really think about it neither. And the reason why I said I really don't think about it is because I have coworkers, and it's so funny that when you smoke, you don't really smell the smoke on you, but when other people do, you smell it on them. It's like it's louder. After that, I came to the group. They asked that I want to join. We started off with a medication. It was the lozenges. So I took the lozenges for a while, and it seemed to help pretty much. But I still was smoking. But after while I was in group, it seemed it didn't fit my lifestyle anymore. As I went different places and stuff, and it just didn't seem to fit. So as I think I took a little bit too much of the medication at one point, and I broke out. But then after that day, it's like I didn't have any desire to smoke anymore. And I guess because I was looking to quit anyway, and the talks really helped me to find out that it wasn't really just the point of smoking. It was things were happening. And I know when I talked in group, Dr. Rebecca, she was very helpful because she would actually, as I explained it, she would how you put that, actually made it simpler of what I was trying to express. And I understood. And then as we talked, because it was a group setting, it became easier and easier to put these different types of coping mechanisms in place of smoking, during stressful times. Um, Especially when I was at home. Different places I would go because I was used to smoking a certain amount of cigarettes or smoking in that area. I really had to fight through it, but she gave me good cope. We would discuss these things in group, different types of coping mechanisms to implement. So, and it worked out very, very well. And so today I don't smoke at all. And I always think of other things to do besides smoking. But I don't,
Congratulations.
oh, I'm sorry.
I was just say congratulations on being smoke free.
Yeah, I'm very happy about that. And I'm glad I am, so many things and it's so funny when you smell it on other people, it's just so loud and it just seems so disgusting now. Just like you never were that person. Like, how could you have been that person? Because it's just so disgusting, seem like.
How long have you been smoke free now, if you mind sharing?
From the last time I had a smoke was, I think it was January the 2001.
Oh wow.
Yeah,
Congratulations.
thank you. Yeah.
And you shared, I
Go
was
ahead.
no, yeah, you shared, I mean, thinking back to Dr. Barrett's talk, and really what smoking, I think, meant to you, or what purpose it was serving. And you shared that both the lozenges helped you and the group helped you kind of replace cigarettes as a cope and use other coping mechanisms in place of cigarettes which you were using. And so that's really, really great to hear. Can you talk a little bit about some of the other challenges you had in your previous attempts to quit?
I think because I didn't know exactly what to do in those situations. For instance, I will be cooking and because I usually cook for the family and say this person want these different types of food, or I have to make sure it's no salt, and the pressure of getting it out on time, and it was just weird thing. And then plus my own personal life, I want to do this, I want to do that, but now I don't have the time because now I got to cook on that day, and things were just going different ways. And so it's so funny because it's never really that. It's like it's the manifest. Like smoking will end up being a manifestation of the things I couldn't control. That's what I felt like at the end. Because like I said, I've tried so many things and tried so hard to stop. And I always wanted to stop, but I would always revert going back to smoking. But after I was in the group, we would always talk about these situations, talk about my day and talk about other people's days as well. Excuse me, and the things we could have done to change that. We can't change other people, but we can control ourselves. And other things we would do, like we talked about meditation, we talked about taking time out for ourselves. We also talked about how to deal with other people, during like conflicts. For example, tell them what exactly you need from them. For example, when I didn't get the dinner out on time, I just would tell them, hey, I can't do it today. I'm sorry. I'm just gonna have to do it at another time, and don't feel guilty about that, and tell them, hey, I'm sorry, somebody else is gonna have to help, do this. We're just gonna have to eat out tonight, things like that, where I couldn't express those kind of things before. You know, I just have to actually put myself out of these stressful things. You know, don't be so demanding on things that I did, you know. So we would discuss on how would I express those things. How would I how could I change certain situations, you know, more positively, or just get out of things, or just count, you know, think about things before I do it. You know, at least give myself, like, I think it was the 5-second rule, you know, think for 5 seconds, you know, just calm down, count to 5, think, stop and think, those kind of things. And it seemed like it started from little things, and it just kept going, and it was better every time, you know, every time we would discuss it in group. Wasn't really about smoking. It just wasn't really about smoking at the end. It was about all these other things that build up to that, to me.
Great,
That's-
great. Thank you. I'm sorry, sir. Thank you so much. And if you folks will stay on when Latasha Dixon talks about the curriculum that we use, I think you'll get a little bit more insight. And we need to push it on. We got about 10 minutes. We're gonna go over
Sorry.
a little.
Okay, sorry.
That's
Thank you.
okay. It's just great that it's all about the patients. That's what we're here for.
So,
Thank you, Serena.
thank you so much, Serena. So let's move it to the panel, the other experts on our panel, and thinking about what Serena's shared, and thank you, Serena, for sharing. We can just do this in an open discussion format, round robin, so everybody feel free to chime in where it makes sense from the panelists. But just maybe initially to start, tell us about how clients access your organization, and a little bit about where you work first, and then we'll get into some of the questions about challenges and barriers. We can go alphabetical if we want. We can start with Chris Abernathy.
Yeah, so how our patients get into our smoking cessation program? Is that what you're asking? Yeah, so we part of brief screening, since AB 541, we've integrated into our health questionnaire. We ask the questions. Our psychiatrist likes to know who smokes as well. And then, you know, some years ago, I attended a smoking conference out in Bethesda, Maryland, and Dr. Philip Gardner showed us quite a lot of stuff with smoking cessation. So I've taken that here to the agency. So we screen everybody that comes through, and then we introduce them to smoking cessation interactions. And I'm starting a lot of the smoking cessation groups on our agency based on the Dimensions tobacco-free program that I've just become a trainer with the advanced techniques with. So we're going to start implementing that with all of our programs. So that's going to be another way folks can get smoking cessation information at our agency.
Awesome. And tell us a little bit about the population you serve.
So co-occurring mental health, substance use disorder, primarily we started providing treatment in '86 up at River Community up in Azusa Canyon. So primary mental health diagnosis is where I get most of the satisfaction out of providing these groups with, because how the population smokes. And so yeah, we're treating both mental health and substance use either as a combined diagnosis or individually in our DMH funded program or drug Medi-Cal SAPC funded programs.
Awesome, thanks. Manuel?
Yeah, so the Department of Health Services in Los Angeles County services almost 750,000 people in primary care, which is the majority of the space where there's screening and referrals happening. Specialty care in some facilities is providing tobacco cessation services, but in general, primary care does carry most of this. And the great thing is that we're screening 90% of our patients in primary care who are active in our clinics, which is incredible. But we have found that referrals through our integrated teams, we have an integrated behavioral health model, which includes licensed clinicians, medical casework, community workers, and substance counselors. There's orders within our EMR, there's warm handoffs that can happen. So while we have those teams and workflows in place and things are growing, we had cohorts of our clinics, as you all heard, taking part in Kick-ASH. We still are only referring about a third of those patients who screen positive for tobacco use disorder. So there's some work to do, but in general, we are screening our entire adult population for tobacco use 90% of the time.
Rebecca?
Yeah, well, we're an outpatient mental health clinic for adults and families, and we offer this specialized treatment service to clients with co-occurring tobacco dependence and mental health disorders. So there's a high degree of smoking population in South Los Angeles, and our clinic psychiatrists have been very helpful in identifying and promoting smoking cessation, specialized services and referrals. And basically the referral will come to me and Dr. Kellogg. And we have a spreadsheet that we maintain, and we make the outreach phone call, or I'll do a lot of outreach phone call and provide some of the information regarding our groups, and then help get them connected to because it's virtual. We're still doing virtual right now, and assist clients with setting up their virtual system, making sure that they're connected, just helping them walk through it, and then doing record reviews, and just sending my phone number and saying, no matter what, you could give me a call if you're having a hard time connecting into the portal. Give me a call. That's a big deal.
And just jumping into kind of barriers and successes, from your three perspectives, what would you say are the biggest barriers, and maybe they've changed over time, but getting clients in to participate in cessation services? Anybody can start. Yeah, go for it. Yeah, anybody. Yeah.
I want to say one of the biggest barriers, of course, we all know, is the COVID pandemic. It made it very challenging. And, we used to have flyers and posters and bulletin boards that clients would be able to see while they were waiting in the waiting room. And, so we're more dependent now on referrals from our treatment teams. And our client population, it's mostly low income, and they don't have a compatible phone, with enough data support, and maybe they might not even have access to Wi-Fi. So, those are some of the barriers that I do notice. That's why we walk them through it. And some of the challenges I also see is, sometimes clients have the, respiratory problems or cancer-related tobacco smoke and severe mental illness. So they need that extra care, that extra compassion, that extra support, to help them, get connected.
Awesome. Yeah, that's really important. Chris,
I agree, Rebecca. I agree. What I like, at first it's slow when you start the goose, but you get the word out that, I have stuff to help with providing the services in the groups, like the carbon monoxide meter, the smokalizer, or I even have a set of pig lungs. One's a healthy lung and one's a cancer simulated lung. And we get a lot of movement out of that. And the word's out that you can have this meter where they can breathe into, and it shows their carbon monoxide level, and it brings people back, because I can tell them, if you don't smoke for 3 days, I can do this again, and you'll see just how much that drops, and you create a little excitement that way. So typically we have full groups, and yes, they go out and smoke after the group, but as long as we're planting the seed and getting this moving along, it's gonna be pretty amazing once we roll out this other program.
No.
Yeah, no, and I agree with all those issues, especially about the pandemic and the conversion to telehealth. But I think on top of that, outside of patient factors, so many now years of deferred care where patients were not receiving screening, where we were deferring preventative services for patients. We're now finding the fallout of that, where folks are now, years out of being asked about tobacco or being, connected to services, people being in the office and not being in the office. I think what we heard from Serena is like that real kind of human connection, the multi-touch brief interventions that are really powerful to help initiate change behaviors in our patients. Those are lacking throughout the pandemic. So I think for the Department of Health Services, as we kind of move into this next phase of the pandemic and recover more, that's really the key where our integrated teams are going to be focusing on is how do we rebuild groups? How do we rebuild brief interventions within this new expanded integrated care team so that we can actually get patients back into that same language and, create that activation so they can actually start, we could actually start supporting them better in their cessation activities.
Thanks so much. Norma, it's 12:15. Are we going 5 minutes over? Or should we?
I think we were. Dr. Hurley just checked in with me, so he's going to tap in a couple of minutes after. So I think we can go a couple of minutes. Let's give the panel.
That's great. Thank you. And so, yeah, I think that's really interesting to hear, right? Across all sites, that this is a really important piece that we lost during the pandemic was that face-to-face care, in-person care. And thinking about that, are you all seeing any trends or changes since in the last year, since we've kind of moved into a quote unquote new normal in clients seeking treatment for tobacco cessation?
Yeah, I think so. I think so. Like, as the DHS lead for this measure, we've seen a big dip, and the gap from where we're performing pre-pandemic was about 60% of our patients were being referred to care, and now kind of at the end of last year, about 30%. That number has actually steadily increased in the past couple of months. So we are moving forward, and I think as we build better system interventions, because we are talking about hundreds of thousands of patients who need screening, who need referrals, tens of thousands who need referrals to care. Building the capacity is really where our work is focused on. Is as we've created pathways, how do the end receivers, who are our substance counselors, our social workers, and even ultimately our providers and nurses, how are we all working together to create that language and change so that patients, understand that this is a important piece, and this is, a service and an organization that prioritizes their health when it comes to smoking.
Chris or Rebecca?
Yeah, and in the past year, the higher prices in cost of living, is causing more financial stressors for clients, and $10 a pack is a common complaint, and clients also prefer menthol cigarettes, have been more receptive to change and smoking cessation services. Clients, have said they're not willing to pay $25 for a bootleg pack of menthol cigarettes, and some clients, regarding housing stressors, Section 8 landlords are not allowing smoking for new tenants, which has been an influence for clients to, hey, let me consider, stopping or reducing this, in order to get housing, and clients are accessing more frequent healthcare services now that there's less COVID restrictions. So advances in technology are allowing x-rays and blood works to move faster, service outcomes are faster. So this gradually, prompts clients to acknowledge and to bring to light their health conditions and how it's related to smoking behavior.
So that's really interesting. So a drop because of the pandemic in terms of identifying and diagnosing tobacco cessation and referring, which hopefully is now kind of coming back, but then also a lot of social pressures, whether we want them to be the case or not, that are actually pushing patients towards cessation. Chris, any thoughts on that?
Well, I think the upswing in us getting staff hired on now, we didn't have a lot of staff for a long time. So finding and choosing the right folks that wanted to provide this service. Now, with this part of the screening and us providing referrals and doing these smoking cessation groups that we're going to implement across all programs, I think we're going to see a whole new change here with how we provide smoking cessation services. It's nice to have staff getting hired again, and that's going to help us.
Do you want to tell us a little bit more about the new programming?
So I went through the Dimensions tobacco-free program through the University of Colorado. It's just well laid out. It's a train the trainer advanced techniques program I went through, and there's simple modules to facilitate and to follow, kind of like a seeking safety kind of curriculum is set up. It involves NRTs and education on vapes and e-cigarettes, and there's motivational interventions. There's quite a lot involved. It's a 2-day training. It's around $800 to pay for, and then it's like I said, it's a train the trainer, so we can get everybody at each program trained so they can facilitate. And there's all kinds of tools we can use and things to help them with, like fidget toys, and these smokealizers with Covita is pretty powerful. That's the one thing that keeps them coming back, is some of these tangible things they can have when they're in these groups to keep them engaged, and give them something to do from one group to the next, and they can hold each other accountable, especially in a residential treatment setting.
Okay,
Yeah.
I think we're gonna have to stop.
Okay.
This is rich. Thank you, all the panelists. Thank you, Dr. Balani, for facilitating this for us.
Thank you guys. Thank you, panelists.
Thank you.
Thank you, everyone.
Thank you, Serena. Miss you.
Oh, I miss you too, and thank you very much for having me.
So happy to